Hello everyone, we are from Group A and our topic for today is about how antidepressants work, specifically the role of serotonin in treating depression. This is a brief outline of the content that we will be discussing today. Alright, so now let's look at the overview of depression and how it is diagnosed. Mental disorder is a syndrome characterized by clinically significant disturbance in an individual's cognition, emotion regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on a feeling of sadness. And sometimes there is no trigger at all, it just pops out of the blue. Then circumstances changes and those sad feelings disappear. Major depressive disorder or MDD is different. It's a medical disorder and it won't go away just because you want it to. MDD, a common but complex illness, can present with a variety of unique symptom combinations. Some of the symptoms that may be present in someone who suffers from MDD is having a depressed mood most of the day, a diminished interest or pleasure in all activities, significant weight loss, feelings of guilt and worthlessness, the diminished ability to think or concentrate, having recurrent thoughts of death or suicide, fatigue or loss of energy, psychomotor agitation, and also insomnia. According to DSM-5, MDD is diagnosed when 5 or more of the following symptoms are present for 2 weeks, with at least one of the symptoms must be 1 or 2.
So what is serotonin? Serotonin is one of many of your body's chemical messengers. It is well known as one of our happy chemicals alongside the comrades dopamine, oxytocin, and endorphins. It is responsible for regulating your mood and emotions throughout the day and is what makes you optimistic. Now what about its origins? In the nerve cells or the RAF nuclei of the brain stem, serotonin is synthesized from an essential amino acid, tryptophan, which can only be obtained from your diet. That's right, I'm talking about your typical proteins such as eggs, meat, and tofu. Serotonin's role is to basically regulate how you feel, perceive things, your appetite, aggression, anxiety, and reward processes. This affects your cognition, learning ability, sexuality, as well as the sleep-wake cycle and circadian rhythms, also known as your biological clock. So this comes to show that low levels of serotonin, or when cert pumps work harder, there's a higher risk of depression, and this will be further explained later on. So back to square one, basically when tryptophan is absorbed into our bloodstream, it travels to our brain where it is converted into serotonin by nerve cells also known as neurons. These neurons are divided into presynaptic and postsynaptic, which are basically point A and B of nerve cells. They work like small factories collecting the tryptophan and transforming it into serotonin. The serotonin is then released into spaces between the two neurons, also known as the synapse, where it can interact and transmit important signals at the postsynaptic neuron reception counters known as serotonin receptors. This will increase or decrease the activity of the nerve cell depending on the brain or body region it binds to. With its job hopefully done normally, serotonin then detaches from the receptors and back to the synapse, which it will be taken out by serotonin reuptake transporters, aka the SERTs, which basically acts as the cleaning crews. Now how does one get depressed from serotonin? So to better understand this matter, I present to you a theory dated back in the 1960s, which is the serotonin hypothesis of depression. According to the theory, it suggests that depression may occur as a result of reduced serotonin levels in the brain. This is mainly due to the lack of function of neurons, which includes alteration of serotonin receptors, the place where serotonin binds to, or SERTs, the cleaning crew I mentioned earlier. For example, these altered SERTs in some of us may remove serotonins faster than normal. So let's just say they really love cleaning. Moreover, decreased tryptophan, the building block of serotonin, will also obviously decrease the production of serotonin available. So all in all, this brings us to the low levels of serotonin, which could interfere with the brain's ability to control mood and emotions, possibly resulting in depression symptoms. This hypothesis suggested medications like SSRIs, which are to be frequently used to treat low serotonin levels and help depressed people feel better by targeting serotonin 1A and 1B receptors. There are many other antidepressant drugs which will be further explained later on, so don't go just yet.
Now, I am sure you are curious to know how serotonin levels are measured, so let's dive into that. Serotonin level is the amount of serotonin in the blood, therefore, a blood sample is required. To determine the level of serotonin, a simple venipuncture procedure is done, whereby a needle is inserted into the vein, and the blood is collected in an airtight vial or a syringe. The blood sample is usually withdrawn from the inside of the elbow or back of the hand. The normal range of blood that is withdrawn is between 50 to 200 nanograms per milliliter. Now let's look at how the venipuncture procedure is carried out. A tourniquet is placed about 1 to 2 inches above the injection site. Then, the patient is asked to form a fist, and this is to identify a vein that is usually looked for, which is the median cubital vein. The doctor will then cleanse the area and inject the needle to withdraw a sufficient amount of blood. While the venipuncture method is a good way to assess the serotonin level in the blood, it is considered rather unreliable to measure the levels of serotonin in the brain. This is because the blood level of serotonin doesn't accurately reflect the amount in the brain, and this is due to the fact that serotonin generally cannot pass through the blood-brain barrier. Thus, researchers are trying to determine the effectiveness of a PET scan or CT scan to measure the serotonin level in the brain.
Now, how do antidepressants work? The main goal is to increase the availability and concentration of serotonin in the synapse so that more could bind to the postsynaptic serotonin receptors and thus relieve symptoms of depression. There are several classes of antidepressants that work to ultimately achieve this goal. We have the SSRIs, the SNRIs, the TCAs, and the MAO inhibitors. Firstly, we have the selective serotonin reuptake inhibitors, also known as SSRIs. Examples of current SSRIs used in clinical settings are sertraline, fluoxetine, citalopram, paroxetine, escitalopram, and fluvoxamine. As the name suggests, they selectively block one of the culprits mentioned before, the serotonin transporters or SERTs, to remove serotonin from the synapse, thereby increasing extracellular concentrations of serotonin at all of the postsynaptic serotonin receptors. Next class of antidepressants is serotonin norepinephrine reuptake inhibitors, also known as SNRIs. Examples are venlafaxine and duloxetine. They work by inhibiting the reuptake of serotonin and norepinephrine into the presynaptic neurons, leading to an increase in the concentration of these neurotransmitters in the synaptic cleft. Apart from this class, tricyclic antidepressants, also known as TCAs, are also used to treat depression, although they are second or third line options due to severe side effects. Examples of these are imipramine, clomipramine, amitriptyline, desipramine, and nortriptyline. They work by inhibiting the reuptake of serotonin and norepinephrine into presynaptic neurons, leading to an increase in the concentration of these neurotransmitters in the synaptic cleft. Not only that, they also act as muscarinic and histamine receptor antagonists, which blocks the action of acetylcholine and histamine, which contributes to most of the side effects. Besides, they also block sodium and calcium channels, leading to a mood stabilization effect. Finally, we have the monoamine oxidase inhibitors, or also known as MAO inhibitors. Now, these drugs are further divided into classes based on their selectivity for inhibiting either MAO-A or MAO-B enzymes. MAO-A is responsible for oxidizing and degrading catecholamines such as serotonin, norepinephrine, and dopamine, while MAO-B mainly degrades dopamine. Examples of these drugs are triamylcypromine and phenelzine, which are non-selective and inhibits both MAO-A and MAO-B, while selegiline is a selective MAO-B inhibitor and moclobemide a MAO-A inhibitor. Depending on the type of monoamine oxidase inhibitors, they generally work by binding to monoamine oxidase, thereby preventing inactivation of biogenic amines such as norepinephrine, dopamine, and serotonin.
So, we've learned about the classes of antidepressants as well as their varying mechanisms of actions. Now, do you really think there are differences in the efficacy and side effects among the classes? SSRIs and SNRIs are considered the frontline classes of antidepressants and exert their primary pharmacological effects through the manipulation of the 5-HT, otherwise known as serotonin system. SSRIs became clinically successful because they reduced the frequency and severity of the side effects that were potentially harmful and eventually increased the level of serotonin in the brain. Ultimately, the decision to use an SSRI or SNRI should be made on a case-by-case basis by a qualified healthcare provider who will consider the patient's unique circumstances and individual needs. On the other hand, TCAs and monoamine oxidase inhibitors are older classes of antidepressants that are generally reserved for more cases where SSRI or SNRI medications have not been effective or when a patient is unable to tolerate them due to the side effects. As we all know by now, all drugs that are formulated and marketed possess a certain level of side effects, and unfortunately, antidepressants are not an exception. All four of the classes exert several side effects which vary from a patient to another, and the diagram here shows the differences in side effects caused by the different classes of antidepressants. Now, what are some of the common misconceptions about the role of serotonin in depression? For the first misconception, it is very easy to assume that serotonin is the only neurotransmitter involved in depression, but that is usually not the case. While the serotonin hypothesis theory remains as the dominant explanation for depression nowadays, many scientific research in the last few decades have revealed that there's a whole lot more to the story of depression. More findings have proven that depletion of dopamine and norepinephrine levels are also involved in the pathogenesis of depression apart from serotonin. The next misconception is that people think that the more serotonin in the body, the better it is. But anything in excess can be detrimental to our body. In this case, too much serotonin causes serotonin syndrome, or otherwise known as serotonin toxicity. Since depression is diagnosed when serotonin levels are low, it is not necessary to increase the level excessively because the mere act of restoring the serotonin imbalance is enough to treat symptoms of depression. So we know that too much serotonin causes serotonin syndrome, but how exactly does that happen? As you can see in the first picture here, it is mainly caused by the increased activity of both the central and peripheral 5-HT or serotonin receptors in response to the high levels of serotonin. Some of the symptoms of serotonin syndrome are anxiety, mydriasis, which is the dilation of the pupil of the eye, increased heart rate or tachycardia, and shivering.
What are the lifestyle changes that can help to boost serotonin levels and improve mood? Fortunately for those out there who are suffering from depression or anxiety, there are effective lifestyle changes that can be done. While medicine and talk therapy are vital to treating depression, cultivating better healthy habits can help promote and sustain a better mood. So firstly, you can increase dieting in tryptophan-rich foods such as milk, cheese, oats, canned tuna, nuts, and seeds. Next, exercising regularly can also increase release of serotonin, so do whatever exercises you love, whether it be lifting weights, playing football, basketball, or even swimming. Also, engaging in activities such as yoga or mindfulness can provide mental health benefits. Then, opting for light therapy can reduce SERTs from binding, leaving more of the feel-good serotonin chemical available in the brain. To do this, you can simply take a stroll outside under the morning sun to feel good. Then, consuming vitamin D supplements can also help to increase serotonin production. Other than that, remember to manage your stress or keep a low-stress environment. Get enough sleep. Make sure to have a proper sleep schedule and have a good and healthy relationship with your partners, family, and most importantly, love yourself. Do what you have to do and remember to smile. So that is all from us. We hope you have understood the content and be sure to take care of yourself. Later.